The reality is that there is a continued gap in the information that has been available, that was available about Black women and their health outcomes in the United States. We need to pay attention to the fact that disparities do exist. They've been ignored for many years. But the important thing about this study is that it looks at women who had never really been given the opportunity to partake in a longitudinal study.
One of the things I really love about the Black Women's Health Study is really feeling like we matter, to be able to think about, okay, what are the things in my life that are affecting my health, and what are some of the things that I wish I knew, or that I wish my mom had known, or that I wish my grandmother had had access to.
Black women's health is often neglected.
And I think it's about time that we are focused on, that somebody that looks at us, because we're an important demographic group, and it's important that our health needs are taken care of.
It's a study that should have happened long before it did happen, but I am so happy that finally it has arrived.
This is a longitudinal study that has numbers that people never thought we would be, and the attrition is nothing like some the attrition rates in other long-term studies.
My research has been focused on trying to find out what factors predict getting the worst type of breast cancer, the type that is more common in Black women and more deadly. We call this estrogen receptor negative breast cancer. In our study, we found that women who had breastfed at least one of their babies had a lower risk than women who had children and had never breastfed.
The importance of place in health has actually been considered for centuries. Where a person lives and what they are exposed to has a role in an individual's health. Our research has really shown that there is a strong independent role of where you live and what is available to you in terms of resources in developing health outcomes across your life. Psychosocial stressors are things that actually really get under the skin in major ways. And one that is unique to women of color and Black women in particular is that of experiences of racism. And this has effect on many systems in the body. It has an effect on weight gain. Because of the effect on weight gain, it has affected other outcomes, including type 2 diabetes, which is a major factor in the African American community.
One of the areas that we're really invested in growing in is cancer survivorship. So some of the things that we're doing is looking at the women who have been diagnosed over follow-up, what were their lives like after that.
I've given a lot of data to the study. And I'm very proud that I've done that, and I look forward to many, many more years of being part of this.
One of the issues we're addressing is when women should go for mammographic screening to detect breast cancers. We know that many Black women have their breast cancers at younger ages, and especially for this more deadly subtype. We're working on a mathematical model that takes into account all of the information that can be used to actually tell women in their 30s and early 40s whether or not they're especially high risk, so that those women who probably should have a mammogram early will be recommended to go.
My daughter passed away 6 years ago of a very aggressive breast cancer at a very early age. And I was told, and also the research that I have done indicates that the type breast cancer my daughter had was most aggressive in women of African descent. And when I questioned why, there was no data.
As women age, we want to be studying factors that are related to healthy aging, factors that are related to reducing the risk of Alzheimer's disease. So that's where our study will be going in the coming years.
As we look at what's happening globally, as we look at how the populations are emerging in the United States, as we look at how people are aging and living longer, we need to have the data so that we can begin to do something upstream. The importance of these efforts, it's monumental.